Well, hello, everybody. Today's episode is all about what it really means to feel youthful, strong, and vibrant, not just for a moment, but for life. We're diving into the science and strategy behind longevity with someone who's redefining what modern medicine can look like, Dr. Farhan Tahir, the founder of Youthful Vitality and Longevity Medicine in Doylestown, Pennsylvania. Dr. Tahir is a quadruple board certified physician in internal medicine, rheumatology, integrative medicine, and obesity medicine with over 20 years of clinical experience. He's known for helping people reverse inflammation, balance their hormones, and reclaim their energy through deeply personalized science based care. At Youthful Vitality and Longevity Medicine, Dr. Tahir practices a root cause systems based approach that looks beyond symptoms to understand how the body's systems interact and influence overall health. His comprehensive programs integrate advanced biomarker testing, hormone optimization, peptide and IV therapies, and precision nutrition to help patients reset their biology and achieve lasting vitality. Driven by the belief that true health is more than the absence of disease, Dr. Tahir's mission is to help people feel youthful, vibrant, and strong at every stage of life, empowering them to live with more energy, clarity, and confidence. What makes his work truly unique is his four quadrant approach, a whole person model that targets the four pillars of lasting vitality: weight, cellular aging, hormones, and inflammation. It's not about chasing one goal or treating one symptom. It's about creating a continuous, interconnected pathway to transformation. In today's conversation, we'll explore how this model helps patients move from fatigue to vitality, from imbalance to confidence, and how everyone at any stage of life can begin resetting their biology for longevity and peak performance. So let's jump in and learn what it takes to truly feel youthful at every age with Dr. Farhan Tahir. Well, welcome, Dr. Tahir, to the Women's Health and Fertility Podcast. I am so excited to have you here today, and I was very much looking forward to our conversation as I've heard only the most wonderful things about your practice through mutual patients and how much you've helped them through conditions such as chronic inflammation and really complex autoimmune conditions. So I'm so thankful for you to be here today. And I'm so intrigued by your quadruple board certification in internal medicine, rheumatology, integrative medicine, and obesity medicine. And boy, what a diverse training and background you have. And I'm just curious to know how this all started for you and how all of this training shaped the whole person philosophy that you currently practice.
Well, thank you, uh, Dr. Yang. You're welcome to call me Farhan. I'm um, very pleased and thankful for this opportunity to talk to you about my holistic approach or integrative approach to solving complex medical problems. Um, I am a physician who wants to treat the root cause, and different every specialty taught me something more to solve the mystery of complex medical issues. And after almost 25 years of practice of medicine, I wanted to create a pathway that can help me in my brain help solve the mysteries so that I can
Mhm.
create it, and that what I call the four quadrant lens that I started looking through it. And
Mhm.
I named most of my protocols and my workup on that four quadrant protocol because each one of them represents one of my specialty
Ah,
that
okay.
brings together the expertise. So rheumatology helps me with autoimmunity and inflammation. Obesity medicine works with excessive weight and inflammation of metabolic nature,
Mhm.
hyperlipidemia, and other metabolic syndromes. Integrative medicine and internal medicine build the other aspects of the four quadrants, which is your health and nutrition, your lifestyle, as well as your hormones. And combined together, I think it makes more sense in my brain. And that's how I started explaining to people.
I love that. I love this approach. I think it's just so uniquely blended. And I think the lens that you're looking through makes sense to a lot of people as well. It's an easy approach to follow, I think, for patients. And I know one of your missions is to help people feel youthful, vibrant, and strong at every stage of life. What is your definition of youthful vitality? What does that mean to you?
I want people to imagine what they would want to be able to do in the last years of their life, last maybe 2 decades of their life. They want to be able to enjoy life with their grandkids. If that's what youthful, vibrant life means, that's what we want to work on. If
Hmm.
they want to travel the world, we want to make sure they are able to do that. And we put the context of their wellness into their targets for their aging process. If their aim is to be able to work and be a CEO of a Fortune 500 company and be able
Yes.
to work and perform at a level that they were able to compete with 20-year younger CEOs,
Hmm.
want to make sure that that would be their youthfulness. If it could be as simple as making sure that you can reverse the existing diseases and be disease free for the rest of your life. Every person is unique, and so is their goals of life. And I want to help understand what their goals are and how can I make it possible for them. And starting from their existing problem, if they have any, reversing them and then rebuilding their health back and optimizing it to a vitality and longevity lens. Whereas if somebody's already in a good health but want to take it to a next level,
Hmm.
offer them anti-aging and cellular optimization treatments so that they can actually be youthful even when they are by numbers they're not in their youth.
Hmm. Hmm.
So that's how I think of it. It's a unique journey for everyone because everyone has different aspirations and goals.
That's wonderful. And I love how you said the reversal of disease and conditions. I don't hear that term very often by a Western medical provider. So I love how you just explained that. And then it sounds to me too that there's so much prevention in your treatments as well, like preventing, further conditions to develop or preventing conditions to compounds and worsen. So, and it's so much aligned with Chinese medicine and our philosophy about prevention as well. And when you see your patients, it sounds like you treat various stages of life. What would you say is the most common patient population that you see currently in your practice?
30 to 60-year olds, predominantly female population, about
Okay.
80%.
Mm-hmm.
And the causes that I specialize in health related challenges, they tend to affect women more than
Mm-hmm.
um, biggest example is autoimmunity and inflammation.
Right.
Human
Right.
body is exposed to tremendous amount of chemicals from young life into their adult life, and they continue to be exposed to it. Their body goes through so many challenges, whether it's hormonal changes during pregnancy, before pregnancy, menstruation on a regular basis or monthly
Mm-hmm.
basis, genetic effects, stress, childbearing, all of that, that leads to a lot of trauma in some ways on their body
Sure.
and leads to causation of disease formation or slowing of their regenerative processes.
Right. That makes a lot of sense. It kind of lends women to be more vulnerable
Yeah,
to certain conditions.
vulnerable to such.
Hmm. So, as far as the common conditions that you treat in terms of autoimmune conditions, what are some of the things, Dr. Tahir, that you see most in your practice that affect these women?
Most people seek me for autoimmunity and inflammation. And
Hmm.
autoimmunity primarily considered diseases like rheumatoid arthritis,
Hmm.
lupus, Sjogren's syndrome, scleroderma, and mixed connective tissue diseases, psoriatic arthritis, inflammatory bowel disease.
Mm-hmm.
Um, we have now started seeing patients are seeking reversal of autoimmunity and inflammation in diseases such as autoimmune
Hmm.
thyroid disease.
Yes.
Um, Today, I had a patient who was seeking help for reversal of inflammation through my approach, and he has primarily neurologic disorders.
Mm-hmm.
Um, when somebody has a chronic infection like Epstein-Barr virus, chronic Lyme disease, now with long haul COVID, a lot of people are coming to me with just symptoms of inflammation, which produces fatigue, joint pain, swelling, rashes, unexplained lack of energy, and just not being themselves. And they have labs that nobody can explain or nobody can
Mm-hmm.
find the root cause. That's how people are reaching me. So I think in autoimmunity, inflammation is the key word that people want me to help with.
Sure. Yes. Well, I am wanting to jump right into your four quadrant approach, since it seems like this model and this lens that you look through is so effective in treating so many different conditions. So, may I ask you to describe this four quadrant approach and what it entails?
Of course. So the four quadrants start with four foundations, the pillars that I want to work on patients' health and build on it. The first quadrant is what we were just talking about,
Mhm.
inflammation and autoimmunity reversal. I want to improve their existing immune system, its reactivity towards their own skin cells, where they're finding their skin body as its own proteins as targets of the immune system and cause local damage that then spills over in their bloodstream and causes overall this tsunami of cytokines that
Mhm.
we call TNF and interleukins and um, cy- different cytokines. And this autoimmunity and inflammation is on the rise because of modernization of the world, the ultra processed food, the toxins
Mhm.
that we have in our environment that comes through plastics, parabens, phthalates, and women are so much exposed to it. I'm drinking water from a plastic bottle because it's hard to carry, or find places where they would be able to, get chemical free world. So our world is very become complex, and as a result, our immune system is under a surprised state, and it becomes sort of behaves as ADHD type of concept. It's like
Mm.
disruptive and causes inflammation, and it recognizes some parts of our body as foreign because we have too many chemicals that have gone into our cells and trigger our immune system.
Mhm.
The second um, quadrant that I focus on is metabolic quadrant, where we can talk about role of insulin resistance, fatty liver disease, hypercholesterolemia, and other metabolic disorders that actually lead to inflammation, but not through the autoimmune cause, but the metabolic inflammatory conditions. Diabetes is an inflammatory condition. Insulin resistance is give an example of diabetic patients have high inflammatory marker like C-reactive protein.
Mhm.
So their abnormal weight gain, obesity, um, is in itself a disease that is a quadrant that I treat and reverse the metabolic inflammation.
Mhm.
So do testing to identify if somebody has high insulin, hemoglobin A1C, and if they have vascular inflammation like elevated homocysteine levels. Um, and we go on to these oxidized lipids, the apolipoprotein B, LP little a, all of those markers that can determine if the inflammation is from metabolic cause. In the autoimmune world, we look at the antibodies, and in this world, we look in the biomarkers that show us the inflammation. So that's the
Mhm.
second protocol
Mhm.
quadrant. Hormonal uh, rebalancing is my third level. So here we see people where there's dysregulation of endocrine system and its communication with different organs. Autoimmune thyroiditis attacks your thyroid. In diseases of you have hormonal imbalance and dysfunction of your organs in PCOS, where we have disruption of the the endocrine system, leading to a form of inflammatory condition of PCOS. Hormones rebalancing also applies to aging. As we get older, we have a difficulty dealing with maintaining growth hormone release. We have difficulty with our hormones like testosterone, estrogen, where they are sex globule. Well, they're sex hormones, but they really affect a lot of our functions of the body and the cells that we don't really think about. Um, and then my last protocol that I look at it is to reverse the aging effects on the body. And, and that enhances our mitochondrial function, our skin rejuvenation, and our ability to regenerate faster. In that last protocol, it is also an interventional protocol to say, because in this protocol, I also offer people peptide therapies. I would offer them platelet rich plasma therapy, platelet rich filtrate therapy, IV nutrition therapy to reboost their cellular energy. So IV vitamin C, NAD, glutathione, Myers cocktails, vitamin C, all of those ingredients, they work on the aging and the cellular optimization, and that's the last protocol. And I have to say that we also offer people facial rejuvenation with some Botox touch-ups and other
Mhm.
things that they want to feel youthful
Sure.
in and out. Yeah.
Hmm. From the inside and the outside, right? Beauty, vitality, longevity.
Yeah.
Well, so Dr. Tahir, I understand that your practice, you have a physical location in Pennsylvania, but you also practice quite a bit of telehealth medicine as well. So for your patients that are not in the area, do you usually refer them out for some of these services in terms of like IV therapy and some of the aesthetic things too? I'm just curious if you have a
Yeah.
network and
That's a great question. So, I do ask patients to research some local providers in their area. If I know someone that I know and trust, I would recommend them.
Mhm.
And I think between the patient research and their um, approach to how they want to take my guidance and take it to their provider and their acceptance on that,
Sure.
we can find people that can work with them. It is
Yes.
definitely a challenge. I do have to say, because what other businesses operating on and how they are operating is a bit hard for me to say. And there's a lot
Mhm.
of chain sort of stores that are focused on like IV bars or
Mhm.
longevity centers that come up. It's good to do due diligence and research,
Sure.
work on what their real intention is to help people. But I
Mhm.
work with them as a personal uh, physician to find trustworthy people, and if I can connect
Mhm.
with them. There are some companies that I've used consistently and found good results.
That's great. Of course, I'm asking you this because I'm a California provider, and I know you're licensed in California too.
Yeah.
What are all of the states that you're licensed in, by the way, Dr. Tier?
So that's a good question. And why I added up, I just every state I visited, and if I liked something out of it, I was like, I should have a license here.
I love that.
So I started my medical training at NYU. So obviously I have New York City, uh,
Hmm.
and in close proximity, New Jersey, Connecticut. I used to see patients from those states and added those in Pennsylvania where I live. I have Virginia, South Carolina, and North Carolina. Those are easy uh,
Okay,
vacation spots for us from
sure.
Pennsylvania. Travel down.
Hey,
So,
that makes a lot of
yeah,
sense to me.
yeah. So I'm just adding Florida. My kids always want to go to Florida for
Hmm.
under Universal Studios. So, and I have family, and my son, who is a sophomore in college in San Luis Obispo in Cal Poly, California. Because of that reason, I actually wanted to live in California, but my job and life brought me to Pennsylvania, and kids
Hmm.
started school, and I decided to make Pennsylvania as my home. But when I was a resident and I first time ever visited California, I wanted to go to California. I enjoy wineries and different type of wines and learning about them.
Hmm.
And of course, California is the best place to explore that. And I just didn't get a chance to live there. And
Well, it's never too late, Dr.
never too
Tahir.
late.
You
Yep.
can establish a second home in California.
That's right.
Hmm.
So, and I have become a consultant for a national company for um, they're spreading a business based on aesthetics at
Hmm.
home. Their nurses go, and I'm a medical supervisor for their nurses, help them train and work with them. And for that reason, I've added Colorado and Arizona as well as my most recent states.
Wonderful.
Yeah.
Those are all great states.
Yeah. Thank you.
Thank you for sharing that. Well, I have so many questions about your four quadrant approach. So, let me start with what your opinion is on some of the peptide protocols, because there's some controversy, obviously,
Yeah.
but I feel like the way you described how you're using it more for like weight management, metabolic reasons makes a lot of sense. And I'm going to be honest, being in Southern California, I see these peptides being used in so many different ways. And where I've seen it help my patients is patients that really do have insulin resistance, maybe patients that have PCOS and they're thinking about, preconception care and conceiving in like maybe the next year. And so oftentimes they'll get on a peptide for a couple of months to kind of get their insulin and their blood sugar regulated before they start trying. So I've kind of seen it used in so many different ways. So I'd love to hear your opinion about the peptides and how you feel it should be most effectively used, I guess, for patients or what your thoughts are about it.
So as the anti-aging field itself is growing, so is the interest in peptide therapies because they
Hmm.
can increase and kind of ramp up our natural processes for production of different enzymes and proteins in our body. And most of them exist in our body already, but they're not being produced enough. Our body has stopped. Our systems is not responding to it. The same goes for the weight loss treatments, the GLPs. There are peptides that already exist in our GI system. We
Hmm.
have just enhanced their presence within our systems to give a boost. They peptides can be of many benefit. I started becoming interested in them because they can help reduce inflammation, and they can help increase lean muscle mass, lower body fat. They can improve overall wellness, even our aging processes like slow sex drive. They could help because they kind of rejuvenate our system, and we can we can promote the growth hormone through a peptide, which can improve our cognitive function. They can improve our bone loss and our ability to exercise. So that's how I looked at it. And obviously, you know that once you want to apply some science to patients, you want to make sure you always get the right studies, the right resources for these medicines, because a lot of times if they're not completely FDA regulated, you have to make sure the sources are legit, and because there can be a risk of contamination of those viruses and other things in those peptides. So going back to your question of peptides and how I am using it in my practice. So again, it's my biggest use of peptides is in metabolic uh, re- metabolic syndromes, auto and inflammation from metabolic or obesity as a cause, because I've seen use of GLP medications like semaglutide or tirzepatide help reduce not only visceral fat, but reduce inflammatory markers. Um, and they, as a result, also help reduce insulin resistance and optimize blood sugar levels. So as you know that back in 10 years ago, metformin was used as an anti-aging drug, and we were using it to reduce high levels of glucose in the blood, because if anything, high blood glucose levels cause oxidative damage to our cells and we age faster. So I think those are the two main reasons I started using peptides in my practice, and started with semaglutide. And now about 30% of my patients are on semaglutide, the
Mm.
ones who need this prescription, and about 70% on tirzepatide. And I'm using it, a ton of it, to reverse inflammation of a metabolic nature. So I use them to improve insulin resistance. In cases like PCOS, we'll use it for androgen access to help normalize their menstrual cycles in people who are pre-diabetic, to just optimize their uh, pancreatic health and
Mhm.
reduce their glucose levels and reverse the risk of developing a full-blown diabetes. People with hyperlipidemia, as you reduce their visceral fat, their inflammatory cytokines, their lipoprotein levels, their lipids levels start to come down. Obviously, this has to always go along with their lifestyle changes.
Mhm. So,
So,
so typically when a patient is on these semaglutides, and I'm sure it's different for everybody, but what's the average length of time that a patient is on this medication?
um, it's based on what goal we are trying to achieve. If a person comes with about 80 to 100 pounds overweight, I would tell them that they will be on it on average about 2.5 years.
Okay.
Because the rule of thumb that I apply in my practice is 1 pound loss per week, but not more than 40 pounds in a year.
Mhm.
I tell them it's not a straight line, and it will be up and down. And plus, you're not a robot that you have to continue to lose it. There will be times in your life you'll be traveling this year, you'll have holidays, you will have vacations, somebody might get sick, you may be traveling, and you will develop metabolic resistance or adaptation. So you would not lose weight. And the rule of thumb is you want to go slow enough that your body and your mind is in sync with each other. If
Mhm.
you're losing weight too much and your brain is like, what's going on? It's going to put the brakes on, and you will not even respond to the highest doses of medicine. Um, so if somebody's, let's say, 20-pound overweight, they can start the medication in 6 months to a year. They can wean themselves off of it, provided they transformed the foundation of their health through microbiome optimization, meaning eating whole foods, hydration, muscle building, so
Mhm.
that their metabolic rate remains high, basal metabolic rate remains high. As we lose weight, we lose muscle, and muscle determines our basal metabolic rate. Now, if a person has lost 40 pounds, and out of that they have lost 15 to 20 pounds of muscle,
Mhm.
their basal metabolic rate from, let's say, 1800 at baseline or 2000 now would be 1300. For them, they would be worse off, thinner, because it would be harder for their body to even optimize a smaller calorie burn, calorie intake.
Mhm.
So it's like we want their body to become less in fat but more in muscle. That
Right.
the lean mass should go up, the visceral fat and the total body fat should go down. And the balance could only happen if you go slow,
Sure. That
because
makes sense.
you have the time to build your body to work out. Most
Mhm.
people,
Mhm.
most people don't have the time or energy to work out. And you put them on weight loss treatments and they don't give themselves enough nutrition.
Sure.
And the amino acids that come from the protein has to be surplus along with weight, and building muscle and exercise during the weight loss. So on my consults with the patient on follow-up that I see them every month as part of our plan to optimize weight, I don't ask them about their weight. That's my last question. I said, have you been able to go work out? Are you doing
Mm-hmm.
strength training? Yes. How many days are you lifting weights? What are you doing for it? Your cardio is good. You can do 1 or 2 days of cardio, but you have to do 3 days of strength training.
Sure.
So that's how I think I go. I go based on each person. So minimum would be 6 months and up to 2.5 years, 3 years.
Okay.
Um,
Thank you for explaining that. And you actually answered some of my other questions because the side effects that I hear about through from patients is commonly the muscle loss. But it sounds like you're also recommending strength training to patients concurrently through their treatment, which is
yeah.
great. And then I hear a lot of complaints about some of the GI side effects. So I'm curious to know what you recommend to help manage some of those GI symptoms.
Oh, that's a great question. So the way that the GLP medications work and they cause the adverse effects is they're through different pathways they work. So one of the biggest problem that I see, we should look at it, what their effects are on our brain and what are their effects on our GI system.
Hmm.
The central nervous system, when these medicines work, they are areas in the brain, the different brainstem nuclei, they get stimulated by GLP, and that triggers uh, the sense of fullness,
Hmm.
satiation, and fullness in our brain, and it suppresses our appetite, but it also activates nausea and the emesis pathway where we vomit or feel nauseated, and that is because the medicine, the peptides they're working on, and they happen to be in the same area where the appetite centers are, where satiation is happening, where fullness is happening. Those signal pathway, how they suppress our appetite, also trigger nausea. Now, the path which is people deal with mostly, its direct effect on gastric emptying. So GLP medications, they slow gastric motility, meaning stomach is not moving down the food or crunching down the food as it used to be.
Hmm.
It's being slowed down. So that is because of the how these GLPs, they affect through the vagal tone are in and neurons in our GI system and the smooth muscles of the GI system. And if during this, so the contractions is going down, and the effect happens is that the food is not being digested enough. Now, the food is sitting in your stomach longer. You don't feel like eating again, but it can also trigger this delayed gastric emptying, would give you nausea,
Hmm.
bloating, would give you sometimes feeling an acid reflux because those muscles or the sphincters that actually block that food to come back in your esophagus, they are not working as strongly. They've been relaxed, and that would lead to uh, acid reflux. Now, their effect on our intestines. So we have our brain, our stomach, and now our intestines. They are also not moving well. We become sluggish in our intestines because of the peptides, and the transit time where the food was supposed to travel down has now become slower and slower, and it causes constipation. And that relates to also a reason that people don't eat that much. But this is one of the issues with people who are not careful enough to take fiber
Hmm.
and enough hydrations, is that it can even lead to intestinal obstruction. I mean, I've
Okay.
had cases where people were transferring over care from other, and they did not know, and they were getting from places where they're not being monitored. They're just being sold the medication
Hmm.
without counseling and without follow up, is they ended up having these situations. And these are dose dependent. So the higher dose, the more the nausea you would get, the more vomiting.
Sure.
So I try to tell patients, like, look, if we can incorporate a better lifestyle, I would use less medicine, less dose of GLP, and then
Sure.
you would not have those side effects because they're
Mm,
dose related. And whenever we increase the medicine, that's where they get the jolts of like,
sure.
okay, my nausea is coming back.
Hmm.
So
Hmm.
lower titration is important. And I want to tell people that always use smaller meals, avoid high fatty foods like fried food. People stop eating fried foods. That's
Hmm.
really, and it can just help make better changes for their lifestyle because they don't feel bad if they eat a grilled meat with salad and beans rather than
Right. Well,
anything.
I would imagine these GI upsets kind of serves as a food aversion
Yeah, yeah, they do.
technique, right? For like greasy foods and unhealthy foods.
Yeah. And I have some of my clients, men who had issue with alcohol, uh,
Hmm.
they have noticed less craving for alcohol,
That's wonderful.
which is less known benefits of these medicines. Um, if these medicines are helping levels of um, desire and addiction in some ways, I think that's being researched right now.
Hmm. Hmm.
We know that truly there are many people who feel that the noise of food has gone down, so they are able to more concentrate and be able to focus on their work or their life in general better, which I think is a added benefit.
For sure. Definitely. And I think if your patients have access to acupuncture, of course I'm biased on this, but I think there are so many things that acupuncture can do to help mitigate some of the symptoms. So like the nausea, like reflux, these are things that we treat very commonly for patients that, well,
I
pregnant
am
patients, chemotherapy patients. So and
my
constipation. Yes.
Yeah, no, I'm glad you brought acupuncture. I'm a personal fan of acupuncture for my own
Wonderful.
couple of challenges of health, including cervical degenerative disc disease that
Hmm.
I happen to have because I'm either driving long periods of time, being on computer, or trying to work out at a CrossFit gym where I'm not supposed to be lifting so much, trying to catch catch up with others, and
Sure.
my back. And the only thing that relieves my pain and my stiffness is, or the radiculopathy pain, the shooting pain, is through acupuncture.
Hmm.
And I'm fortunate to have a master acupuncturist in my area, about 40 minutes drive, and get treatment for myself on that. And I've always recommended people who chronic pain and autoimmune diseases to consider
Hmm.
acupuncture, Reiki as ways to help your mind and body together.
That's wonderful, Dr. Tahir. I'm so happy to hear that you're getting some benefits yourself.
Oh, do yeah. I wish I could do more, but I've gone always whenever I'm in trouble, I got acupuncture to rescue me. I've never had an interventional radiologist to put a needle in my neck for my
It's a
for
little hard to reach yourself, right? You need a little assistance there
yeah,
for sure.
yeah.
But definitely consider it for some of the GI side effects
I would.
or
Thank you for
for
mentioning
the
that because
medications.
I do know that I have a close relationship with a acupuncturist, and she runs a fertility clinic.
Hmm.
And you go into her acupuncture center, and the wall is filled with cute babies pictures because
Yes.
those families were their fruit of their work, that they could bring a beautiful life on this world. But yeah, so I would definitely keep that in mind.
Yeah. Well, on the note about fertility, I'm glad you brought that up. So I'm curious to know how can this four quadrant approach be applied to fertility patients and certain conditions within infertility like PCOS,
Yeah,
endometriosis.
I would walk you through through the lens of PCOS, because I think the weight and metabolic optimization comes as a foundation for those targeted patients, because up to 80% of PCOS patients, they exhibit or they have this insulin resistance behavior,
Hmm.
which is a major driver for an ovulation or not having the regular ovulation cycles.
Sure.
And hyperinsulinemia or high insulin levels would also drive high androgens production, which will lead to then effects on their follicular function of the
Hmm.
ovarian function, leading to infertility. So, how we can, whatever way we can decrease that insulin resistance early on, we can bring back that reversal of that metabolic inflammation. Obviously, decreasing the target is to decrease their visceral fat, because most women in that who who deal with that situation tend to struggle with weight, especially in the belly area,
Hmm.
visceral fat, and it enhances the, so we can enhance that way. And for that, I mean, there are nutraceuticals that we could use, there are lifestyle changes, but I think that hormonal reversal and metabolic inflammation is can help tremendously with GLP medications. I
Hmm.
use them and I offer them because I say that it's temporary. Once we can reverse it, you can go back to your, but achieving your fertility. So like somebody's trying to run a marathon and they are 40 pounds overweight. Getting them on their training and giving them GLP is not really is considered cheating. You're just helping them achieve their goals through the right way. And
Hmm.
as they build their, the same way, achieving if fertility is a goal for some people, and if we can help them reverse it through knowledge and safe practice of giving them prescription of GLP medication, it could help reverse them, and it can lay the groundwork for hormonal balance and regulation, and then follicular development. The second, I want to say that my four quadrant approach works on um, the most modern world. We have seen that there is a lot of cellular aging or degradation going on from the
Hmm.
exposure of toxins, because the amount of, I think that there's a podcast I was listening to on evaluation of how we need to address evaluation of toxins burden, that the heavy metals and other toxins exposed to people, especially women who are dealing with fertility issues, because
Hmm.
actually they may be contributing to their health. So, from the cellular and aging optimization, how to keep their ovarian cells
Yes.
younger,
Right.
more youthful, so that
Hmm.
they can produce the cells, we have to look at their mitochondrial function of their cells, and how can we reverse the oxidative stress that impairs the quality of the eggs and the implantation success of it. And through reversal of metabolic inflammation and optimization of the cells of the ovarian follicular cells, we can then lead to improved outcomes. So the factory is working, the environment is working, we're getting the raw material, and it will produce the result we are hoping. So mitochondrial support, like use of coenzyme Q10,
Hmm.
L-carnitine, alpha-lipoic acid, along with antioxidants through food and supplementation would do. I also enhance um, based on people's needs, whether they need another peptide to add into their picture versus or just using GLP, depending on where they stand. I've used
Okay.
thymosin beta B4. I've used BPC in repair processes and improving blood flow. So that is the second, I would say, the step. And I do check their hormones, of course, which is the hormonal optimization quadrant that I would say,
Sure.
where we want to look at their cortisol, their stress. Stress can disrupt their HPO, hypothalamic pituitary axis.
Mm-hmm.
Fixing that or reducing their day-to-day stress by giving them maybe adaptogens to help it. Meditation, as you know, uh,
Hmm.
there are herbals in the traditional Chinese medicines that can help enhance that function and optimizing of their hormones. And that could focus on their luteal function, their follicular function, and we can see where their progesterone is, where their estrogen levels are, where the
Hmm.
testosterone level. Once we fix that, it will lead to better evolutionary cycles.
Right.
So that's, and the last thing I would say, let's make sure that their autoimmunity and inflammation is not a contributing
Yes.
factor, right?
Right.
So if a women symptoms are suppressed, their ovarian function is suppressed because their chronic inflammation from underlying lupus or rheumatoid arthritis, or they have a medicine that has been given and that could have disrupted their, like methotrexate as being example. So either the immune system is dysregulated or is immune suppressed, and finding
Hmm.
that root cause, fixing that, giving them anti-inflammatory nutraceuticals like omega-3s, curcumin, quercetin would help, along with I believe autoimmunity can easily be manipulated with microbiome, repopulation of good bacteria in the
Yes.
gut, optimization is
Hmm.
really good, and improving their sleep quality. So that's where the fourth quadrant would come in. And I'm fortunate to say that once the clients understand that protocol and they start working on it, we do see that the results start showing up, and it's very rewarding for both of me as a provider and them as a patient who's been struggling with challenges.
Sure, that's amazing. Well, so most of the patients that I see for fertility, of course, they want to be pregnant yesterday, right?
Yeah, yeah.
So, in terms of time frame, if they were to follow the four quadrant approach, you know, what is the standard of care for this protocol for these patients? How long can they safely be on a peptide before they start trying, or do they need to take a break before they
I
start trying after they finish their protocol?
I think that case to case basis, but on average, depending on the root cause of their issue, we
Sure.
see that 6 months is average time
Mm-hmm.
for us to reverse and show some reasonable results. And 6 to 12 months is the time period where we would say either we back off the treatment, wean off the treatment. And I like to give 3 months in between
Mm-hmm.
where they actively stop the contraception and actively start trying. Uh,
Sure. That makes sense.
one of the ways that I would push to make sure that they're getting all the nutrients is even during the treatment when they are being on GLP medication. First of all, I try to use as low dose as possible.
Mm-hmm.
Even I've used microdosing in some people. I've
Mm-hmm.
used like 2.5 for like 6 months, and that's usually enough for some people.
Okay.
Um, if and once they achieve that, during that time, making sure that we do a micronutrient lab testing,
Sure.
suspect that their digestion system is not good, their gut permeability is not enough optimized, and they're not absorbing it. Some nutritional levels are really important when it comes to
Mm-hmm.
pregnancy. We know, folate, B12, optimization of their hormones, make sure their thyroid functions are all good. So there's a active problem that we try to solve in 6 months, and then there are what we call the loose ends to make sure that we give a finishing touch, which is another 3 months. So I would
Right.
say a realistic approach would be 6 to 9 months for people
Mm-hmm.
to be able to get onto a just the same amount of time, almost 9 months would take to a for a pregnancy. It's about the nine
Right.
months time that you would invest in working on yourself to see the results.
Sure. And that's worth it because you want to optimize your fertility to have the healthiest pregnancy and the healthiest baby you possibly can.
And I don't want to forget, the tree for the fruit, right? I mean, the mom has her health also in in the forefront of our mind because we want to make sure mom is healthy to take care of the life that comes on this world, right?
Absolutely.
And
For
most
sure.
of the time when the baby is born, everybody forgets about the mom, and that's not really that fair because she also is a person that actually needs help because all this time she was devoting part of herself to bring this life. So during my treatment, I want to focus on her nutrition, her sleep, her exercise, her physical and mental health as well. So that's why I think it's not something we can say, well, it's just going to take you a month and you'll be there. It's not.
Right. Well, I love your approach and how you really think about the mom as well, because I've seen when a patient is healthier in the preconception period and into pregnancy that their postpartum recovery is so much better as well.
Yeah. And I think a part of we have to always understand that the challenges that women face postpartum hormone changes, even mental health wise, it can be a challenge because there's a lot of body changes that have happened, their self image changes, and supporting them through that and bringing them back to the idea that the physician they're working with understands that where you want to be after you have done your duty as your mother to bring the life in this world, that you want to look the same that you looked before. You want to feel the same woman, the youth that you had before you gave birth. And we want to make sure that we can get them back on the track for it. So I say to them that we're going to take a pause, but we're going to meet again to get you back into your life where you were, where you'll be able to exercise again, you'll be able to look and feel the same that you were on. Because a lot of times when I hear people, they said 20 years ago when I had my first child, my life
Mhm.
changed. I
Mhm.
was never the weight again. I was never had the same energy. I could never, because your body sacrificed so much, but then after that you had nobody who could help you rebuild it back to where it was before, which is possible, but only it's not possible in this stressful world we live in, especially if a mom is left alone without guidance to build her back again into where she was before or where she wants to be.
Right. I love that approach. So this four quadrant approach just seems like it's applicable for so many different conditions and different phases of life. And I think that being able to care for women in that way is so valuable. And like you said, reminding women too that you can be, you can be the best version of yourself in every phase, and that you don't have to settle into this, this is just how it is now.
Yeah,
And
yeah.
this is the new me. Like
The
it's
new
never
me,
going to
yeah.
get better.
Yeah,
Right.
I was a runner and I cannot run again, or
Mhm.
I was an athlete and I won't be, or I would enjoy this. Like, we want to optimize their through this four quadrant approach, not only keep and reverse them to achieve what they wanted to do, but keep them in that state so that they continue to be youthful and vibrant as they were before. And if fertility had was a challenge, it doesn't remain that struggle again.
Right. Right. And so they have an easier time as they enter into like baby number two or baby number three,
Yeah.
or however many kids that they want. Well, gosh, this has been such an interesting interview, Dr. Tahir. I feel like everybody needs to really think about this four quadrant approach and work with you.
Thank you.
I really am so intrigued by the whole philosophy. But before we wrap it up, would you be able to give our listeners, if you were to give one piece of advice for reclaiming vitality, regardless of what stage of life somebody is in, what would that be?
I would say don't be ashamed to love yourself. Don't be
Hmm.
ashamed to give yourself at least 5 hours in a week for your personal well-being. That could be in the shape of getting an acupuncture, a massage therapy, a personal training session, a sauna. It could be a hike. It could be catching up on your sleep. It could be prepping a whole food as meals for you that are wholesome and free of toxins and pesticides and chemicals. Um, I would say that would be the best investment you can do. And if you improve your protein intake, your nutrition is good quality, you will build a life of full of youthfulness with vitality, and you'll be set for longevity. Again, don't be sorry that you have to say no to something because you have to go and work out. You have to catch up on your sleep.
Hmm.
That's what my um, piece of advice would be. Everything else comes second. We are ashamed to say that I am being I'm focusing on myself, on my well,
Mhm.
and that's we should not be.
That's perfect advice. I love that. So, Dr. Tahir, do you have any upcoming events or workshops that you would like to share with us about?
So our a local wellness day spa and my youthful medicine practice, we have quarterly sessions, dinner meetups where we talk about different topics which are of concern, and we give them the same four-quadrant approach along with services that are offered at the day spa. They tend to do lymphatic massages and detox and other things. So we had an event yesterday on how to prevent cancers through epigenetics and
Mhm.
how to change that. We are working on creating some more series coming up in the future. At this time, I think that I don't have anything in particular planned. We
Are
just
these events available virtually too?
That's a good question. We have not publicized for virtual um, audience, but it is with this day and age, the technology exists that it can be done.
Yes.
We have started recording video recordings of them, but we can always propose that to our team of people that we should consider that, and we'd be happy to share with you and your audience.
Well, that would be great. And if you are able to do this before our podcast is released, I'll make sure that I share all of that in the
For
show notes as well. So how can a patient connect with you? And how can
sure.
what's the best way for them to reach you?
Um, our website works as a good resource for us to connect with clients, collaborators, and it's youth like young, youth, youthfulmedicine.com. And when they get onto that website, they will be able to uh, create they can learn about our services, and they can also connect with us using the contact us form at the bottom of the page, where they can inquire anything that we may be able to help them.
Wonderful. And as far as the telehealth options available, are there also like discovery calls or ways that they can maybe connect with you to learn a little bit more about
Yeah,
your
so
services?
what we request people is that once they reach out to us, they choose the service that they're looking for us to help them.
Hmm.
Whether it's one of the four quadrants, and in the message they can say we would like to request a discovery call for us to know how your protocol can help. We can then schedule a 15-minute conversation and
Wonderful.
send them information um, like a handout of our protocol for that particular, and then we can take it from there.
That sounds great. Thank you so much, Dr. Tahir, for taking the time to chat with me. And I'm just so looking forward to being able to release this podcast.
Thank you so much for this opportunity, and you're doing a great work for awareness of people and making their lives better. And it's one podcast at a time, but
Thank you.
it will grow, and I'm thankful for the opportunity. So keep up.
Thank you so much. It was my pleasure.
All
Thank
right.
you, Dr. Tahir. Have a wonderful day. Thanks.